I am Michio Suzuki and CEO. Today's topic is intracranial multimodal sensor for stroke, trauma, epilepsy, or cardiac arrest. This is our sensor, and EEG electrode and brain temperature thermistor, and LED and photodiode sets for near-infrared spectroscopy NIRS to measure cerebral blood flow and brain tissue oxygen saturation, an ICP sensor on the flexible electronic substrate polyimide. Latest prototypes has 2 channels. Why do we develop this sensor? Because severe brain injury shows notorious prognosis as death or bedridden. Such patients would be at least 1 million per year globally at least. The main cause of them are brain edema and ICP elevation. However, there are still essential unmet medical needs to treat this disease. This is a timeline from injury. A current diagnosis is for brain edema or ICP elevation, but too late, unfortunately. We have to treat secondary damage immediately after injury, for example, ischemia, hypoxia, epilepsy, CST, or neuronal death. Unfortunately, there is no good tool to diagnose. To fulfill unmet medical needs, we had to establish our sensor. We experienced 50 cases. Among them, 13 were approved by Japanese government. No adverse effect. PMDA suggested clinical trials unnecessary. This is sensor's data. There is the depolarization and the depolarization. Depolarization causing ischemia is easy to diagnose by our sensor. This is a data set of epilepsy. Right side, even cortical EEG does not show any EEG activity, but we can diagnose epilepsy by remaining data set. This is a market size. Even for trauma patients alone, it was huge. In 2020, the size was over 1 billion, and middle-income countries also promising. There are competitors. Most of them have 1 or 2 modalities, but our sensors have 4 modalities. Future perspective. First of all, software as medical device. Multiple data from the same lesion does very much fit deep learning for diagnosis, far beyond a non-invasive or wearable sensor. Telemedicine is also promising. Our business plan for manufacturing and a sales company, we would like to ask M&A, FDA submission, or patent royalties. For VC, we would like to ask $2 million. This is tentative financial planning if the sensor is released in the 2028. You will see quick turnaround. This is intellectual property lists we have. Some of them are US or EU patent. These are ANT's member. CEO is me, COO, CTO, CFO, CSO, IPO, secretary, and researchers and principal investigators. Thank you for your attention.